Joining us now to talk about the risk of child trafficking and abduction in Haiti after the earthquake, Lisa Lauman, Associate Vice President for Child Protection at Save the Children. Also, Maggie Boyer, she's Communications Director for World Vision in Haiti. And CNN's own Anderson Cooper. Lisa, how worried are we about child trafficking in this tragedy?
Well, Larry, we were worried before and we're worried now. I will say that there are a lot of stories out there, a lot of rumors, and a number of organizations, UNICEF, Save the Children, World Vision, are trying to follow them up. To date, we haven't really found evidence that any of these stories are true, but that doesn't mean that children are not at risk. So we think it's very important that all humanitarian actors remain very vigilant.
Maggie, it is quite a danger, is it, since so many children are scattered around? We don't know if their parents are living or dead. They're certainly open to this, aren't they?
That is correct, Larry. Before the quake, there were about 380,000 children labeled orphans in Haiti, and you can imagine that number has increased since the quake. So World Vision is certainly mindful of that number and working very hard to keep track of those children and ensure their well-being.
Maggie, by the way, is coming to us via that Skype gadget, which is amazing how it works. Anderson Cooper, have you seen any evidence of this at all in your reporting?
We've looked into it. We were given a heads up on two allegations, two stories that were floating around. UNICEF kind of turned us on to. We investigated both of them. We did not get any evidence of any kind of trafficking in those two incidents. We've certainly talked to UNICEF and Save the Children, who say they are clearly on the lookout. And what's really important, Larry, is that now a lot of these organizations really want to start tracking, try to get their hands around how many orphans there really are, who really is an orphan, who may have other family members that they're just separated from who want to take care of them. But we also saw this in the wake of the tsunami in Sri Lanka. There were a lot of concerns, a lot of rumors about child trafficking. We investigated those. It was very hard to find actual evidence of it. But Larry, Haiti does have a history of not just child trafficking internationally or going to a Dominican Republic, but also internally. Kids are sold often or given by poor families to other families living in the city. And those kids will grow up as domestic servants working for a family. So that's something, that's a form of trafficking which happens right here in Haiti and happened long before the earthquake.
Lisa, how does trafficking work? Give us the modus operandi. What happens?
Well, it's difficult to say, obviously, because it's a clandestine form of activity. But often traffickers are people who are known in communities. They develop relationships. Often the kinds of trafficking that happen in places like Haiti, the reste avec, or reste avec in French, stay with phenomenon, is something that happens when a family feels that it can't care for its children adequately, and it sends them to what it presumes to be a wealthier family in another area to provide domestic service in exchange for food and shelter and clothes and possibly an education. What happens often, however, is that the terms of the child's living there are not very well, they're not monitored at all, they're not very well established, and children are often treated harshly. Sometimes there's violence, sometimes they're not provided the entitlements that they think they're entitled to, and sometimes they're sexually abused. Often they're caused to leave those families before they turn 15, which is the age at which they should be legally paid, and then they go on the streets.
And how much sexual slavery, Maggie, is involved in this?
Larry, I think when children are abandoned or separated from their families and not in the care and affection of their parents, they are exposed to all kinds of dangers, including sexual exploitation, which of course is not unheard of in Haiti. We have seen some statistics suggesting that up to maybe a third of our young women, especially in the city, do suffer some kind of sexual violence. So it is a danger here, even before the quake. And there's no reason to think that those numbers have decreased.
Anderson, how do we know an orphan is an orphan? When you see a little child on the street there, how do you know if the parents are living, what the situation is, if the father living, mother dead? How do you know?
Well, you don't really know. I mean, you can talk to them, but oftentimes they are simply separated, and they will tell you, you know, I heard my mother died, but I don't know. I mean, people just disappear here, Larry, in the earthquake. you know, a mother goes out to buy something at the store collapsed on her, the child hasn't seen her but has heard through stories that she's dead. So there really needs to be a system in place. I know UNICEF is working on it, Save the Children as well. I'm sure the Red Cross will be involved in trying to identify and basically catalog all these unaccompanied minors out there with the aim of reuniting them with parents, if parents are out there, reuniting them with other family members, or figuring out, you know what, these kids really are orphans and will need some sort of either orphanage here or some sort of international adoption.
We'll take a break. When we come back, we'll ask if adoptions maybe are taking place that shouldn't be adoptions. Don't go away. Lisa, is it possible that a lot of children are being adopted haphazardly?
Larry, we don't actually know. We know that some children have left Haiti already to go to other countries. I understand that the children who have come to the United States so far were children who were in the process of adoption, and so far along that there was almost no question, or no question at all about what their status should be. I think the concern now is that we not rush to adoption, and we not rush to the assumption that these children don't have parents or don't have extended families that might want to care for them. Adoption may be an important and necessary option for them down the line, but the first thing that we need to do is make sure that if they have family that is out there, if there are neighbors and community members who want to and have the capacity to care for them ethically and responsibly, that we're in a position to let that happen before it's too late.
Maggie, I know that you met with the President and First Lady of Haiti. Did you discuss the possibility of this problem with them?
Larry, I did have the honor of meeting the President and the First Lady this morning, and I did have the opportunity to bring up to them World Vision's is concerned with the well-being of children. And I'm glad to report that the First Lady was already aware of that and is working on an initiative. And World Vision is looking forward to perhaps assisting the government in the coming weeks and days, especially the First Lady's office, about this initiative concerning children. And Larry, can I just add one more thing, just on my colleague from earlier? The Haitian Prime Minister had, in his daily meeting with heads of agencies, made it very clear in no uncertain terms a couple of days ago that any hasty adoptions are not likely to succeed. The government has granted some expedited adoptions, but those were already in process, and they were done on formal requests from embassies here. So I do think the government is aware of the danger of hasty adoptions, though the impulse is certainly understood, and I don't mean to impugn those who would want to do that. I understand the impulse of wanting to help children, but just to clarify, the government is aware of this problem and is very, very much on task about not allowing that to happen.
Anderson, trying to get a picture of this, are there a lot of children just running loose?
You come across kids all the time who are identified as being on their own. I mean, you go to General Hospital. I met a little boy named Johnny who was 5 years old, didn't know his last name. The nurse there told me he had no one watching over him. She was particularly keeping an eye on him. I met a Restovic girl in another hospital out by the airport. I was in a church that had about 20 kids who they identified as orphans. They had made a list telling me all these kids were up for adoption. It was very unclear whether they wanted some orphanage here to adopt them or I mean, there was even an indication they were willing to let me just take these kids. So there's a lot of kind of kids kind of floating around in ad hoc groups with maybe some adults, some locals looking after them, but they really need to be watched over in a much more, organized setting by international groups, by Haitian orphanages, and really get a sense of how many there are and exactly what their needs are.
Thank you all very much. The State of the Union is coming.